Okay, let's get started. We're going to be looking at some animation for the insertion technique for the Prestige ST artificial disc. This is a model that simulates a degenerated cervical disc, and we're going to be zooming into the area where we're going to be working. In the first part of the video, we're removing some of the anterior bone spurs and arthritis with a little surgical biting device, and then we're accomplishing a more complete job with the drill, smoothing out the surface so that we'll have a nice flush surface for the eventual placement of the artificial disc. Our next job is to make sure that we place distraction screws on the midline. It's very important that this is very precise, and we place 2 distraction screws followed by inserting a distraction device. And now we can clean up the cervical disc to help remove the arthritis and herniated disc material. This is accomplished with scalpels and biting devices, and then we begin the process of taking away all the years of arthritis. This is accomplished both with a drill and other surgical instruments, and we're going in and we're making nice flush surfaces for the eventual artificial disc placement. We want to remove any osteophytes or spurs, remove any residual disc material, and then we also go in with surgical biting devices called the kerrison to remove any bone spurs near the spinal cord or the nerve roots out on the lateral aspect in an area called the foramen where the nerves escape. Here's some more video showing removal of bone spurs more laterally over the nerve root. And once all of the decompression technique has been accomplished, you can see that we have a nice clean spinal cord, and now it becomes time to remove the distraction device and to get ready for the insertion of the artificial disc. We have to size the space to make sure we pick exactly the right size artificial disc, and we have several instruments that allow us to help with this. What we can see here is that there's too large a size placed into the disc space, and this is causing some over distraction of the facet complexes. We want this to fit just right, and so we have multiple sizes. And when we find the correct size, we can see that it fits just properly into the disc space without causing over distraction. Now we're going to remove this and do some final sizing for the placement of the artificial disc itself. We've removed the distraction screws. We want to make sure that there's no binding, that we have a nice parallel surface, so something will be able to move without any friction. And some final cleanup with a nice drill bit to make sure all of our surfaces are flush prior to insertion of the final artificial disc. It's very important that the screws are placed in the right trajectory, and to accomplish that we have an insertion device that allows the screws to be placed at a very specific angle. This gets tightened and secured to the artificial disc, and then it is lowered into the disc space. Once we have this in final position, we then place drill guides, and each of the individual screws are placed at exactly the correct angle, sequentially from the top to the oblique lower corner, until we've placed all of the 4 screws in the initial portion of the insertion process. Once all of the screws have been placed, we then remove the insertion device and we start the process of final tightening and ultimately placing the locking screws over the screws so that they're secured to the interface of the artificial disc. This prevents any kind of back out or loosening of the device over time. Here's the removal of the insertion device, final tightening and placement of the locking screws. Everything is secured into final position. And now you can see some video that show all of the benefits of the artificial disc. We see nice flexion and extension with normal motion of the disc that we've just cleaned up, and no hypermobility or abnormal movement at the adjacent levels in the cervical spine. Thank you.